In that light, our next two speakers are going to share the perspectives from the point of view of the scholars who are part of the center and from the point of view of the industry experts that are part of it. Now, leading off will be Michal Grinstein-Weiss. Dr. Grinstein-Weiss is the founding director of the center. She's also a professor at the Brown School and associate director of the Center for Social Development. In addition to launching the center, because she needed more things to try to do, Michal's most recent work efforts have focused on work in her home country, Israel. She recently spent several weeks speaking and consulting for the government after a proposal that she authored and created for creating universal children's savings accounts was passed into law in late 2015. Following Michal, Jeremy Corbett will provide some insights from the industry point of view. Dr. Corbett is the Chief Science and Product Officer of Envolve People Care. In this role, he provides oversight and guidance from the industry side for this collaboration and the rest of the work that we do to continue to develop behavior change within our company. He'll also be instrumental in helping to translate the work of the center into activities and tools that can be applied in a practical way at a scalable level. Jeremy brings a wealth of experience to this. He served as a chief medical officer for several health plans. He's also served as a chief medical officer for a biomedical startup. In addition, Jeremy is an emergency physician who is in active practice because he too apparently doesn't have enough things to try to do. So with that, I'll welcome Michal up to talk about the center and how we're moving forward.
Thank you, John. Okay, now this slide. Okay, so I just want to reiterate how excited I am to be here today to see this coming to fruition and to have the launch of the Envolve Center for Behavioral Change. But this special event and the establishment of the center could not have been happened without the support and contribution of the Centene Corporation. So I would like to thank Michael Nadroff, Jesse Hunter, Dan Cave, John Porter, Karen Quinn, and the entire Centene team for working with us so hard and for, few years now to trying to get to this exciting and important moment. I think it's symbolic that we are starting our center and launching this event at the beginning of the new year. And before I'm talking to you about the center, I would like to ask you a few questions. So how many of you have a health-related New Year's resolution now in the beginning of the new year? Like, exercising more, drinking more water, eating more fruit and vegetables. Please show hands. Okay. So now that it is 4 weeks into the new year, how many of you have, broken in a little bit or cheated just a little bit on your New Year's health resolutions? Please show hand. Okay, you are not alone. About 50% of the American population are making New Year's resolution, and 52% of them are really confident that they will stick to their goal. But by February, 64% already did not stick to the resolution. And by the end of the year, at least 88% are not sticking anymore to their goals. So what happened? Life happened. We know that stress, overload, and low energy stop people from sticking to their goals. Now, this is especially hard for low-income families. If they have to also worry about access to healthy food, a high mobility rate, spell of unemployment, emergencies, that make it really, really hard to stick to their goals. And increasingly, what we are seeing is that poor behavior contributes to chronic disease and premature mortality. And this trend is increasing. While in the 1900s, only 5% of premature deaths were associated with poor behavior. It was 35% in 2010. While this is a devastating statistics, there is also an opportunity to stop this trend and improve health through behavior change. And this is the goal of our center. We bring academia and industry together to work on this important mission of help people act on their intention and be healthier. We're working to develop and test rigorous scientific innovation, and we will apply them and test them in this real-world application and setting of the Centene members. What we'll find will work, we will be able to scale up to millions. And by doing that, we will be able to impact healthcare industry and advanced science. We're also working very collaboratively, and I think that's what we are so excited about. It's suddenly coming out from the university. It's working with everyone, dietitians, operational managers, researchers, doctors, coaches. This is just to name a few. You see, like, we have lots of arrows going around. And what we are going to focus about is 3 main areas to begin with. We're going to focus on behavioral economics as a way to help improving health behavior. We're going to focus on intergenerational lifetime change. So we're going to work with families, but not only with the adults or the kids. We're going to work with both, with the caregiver and the parents and their children. And we're also going to tailor communication to improve health outcomes. And we are fortunate that we have the best expert on all this field, and you will very soon hear from each one of them on their area of work and what they're planning to do. So with that, I would like to invite Jeremy Corbett to share with you the industry perspective.